Okay, so our first category today is going to be health and wellness. Okay, and then our first presentation is actually from a group of students who are not here today. They are at NAU, they're in the occupational therapy program in Phoenix, but they've recorded their presentation, so we'll watch it now.
Hello, my name is Brianna Lees.
I'm Courtney Tosto.
I'm Kelsey Christopher. We are second-year occupational therapy students at Northern Arizona University. The other authors listed are part of an interdisciplinary team that lead and support the project. We chose this project as part of our OT research curriculum and will be involved in the project throughout our graduate studies. The project, titled Healthcare Self-Advocacy, considers how navigating the healthcare system can be challenging for everyone, but for individuals with intellectual or developmental disabilities, it's often even more difficult due to the systemic barriers. These barriers deprive individuals of their right to quality healthcare. There's a lack of resources available to support individuals becoming healthcare self-advocates. Existing resources do not always center on self-advocate perspectives. Rather, they may present information for healthcare providers or supporters. The purpose of this project is to work with adults with intellectual or developmental disabilities to create videos and resources to help other individuals with disabilities take charge of their healthcare through self-advocacy.
Our project activities include, we have steering committee meetings with self-advocates that follow our learning objectives, where we talk about their healthcare experience as an individual with a disability. We have weekly team meetings where we meet for an hour to discuss any updates with the project and future plans. We've created a resource guide for self-advocates, supports, healthcare providers, and researchers to reference on self-advocacy and healthcare for individuals with disabilities. And we have also included inclusive resources both in English and in Spanish. We've also worked on self-advocacy videos, and in the middle, there's a couple pictures of our self-advocates and what the process looks like. We use our past steering committee meetings as a guide for our video shoot and follow our learning objectives to discuss their healthcare experience as an individual with a disability. The learning objectives that we follow to guide our discussion and videos with the self-advocates are: what is healthcare self-advocacy? How do you identify your healthcare needs? How do you value your health and your healthcare rights? How do you prepare for healthcare visits? How do you make decisions about healthcare? And how do you make decisions about healthcare with support?
So now to discuss some of the self-advocates' perspective on accessibility, as well as what advocacy means to them from the videos that have been made so far. And it should be noted that the self-advocates come from a variety of diverse backgrounds, including individuals with intellectual and or developmental disabilities, wheelchair users, those who identify as being visually impaired or blind, individuals who are hearing impaired, deaf, or hard of hearing. And one self-advocate mentioned that every individual has a right to have full access to their health information. Accommodations can be necessary in order to have full access. Another self-advocate mentioned that during appointments, providers often speak to supporters rather than the individual with a disability. And here are a couple of direct, powerful quotes from self-advocates. One being, partially accessible to me is not accessible, and I have my own way to speak up. The implications of this project are that this highlights the significance of being inclusive and allowing diverse individuals to have the ability to be their own self-advocate. Self-advocates should be the one directly speaking to those who are self-advocates or to healthcare providers regarding how they can be better at providing care for these individuals, not through a voiceover or from the healthcare provider perspective. The self-advocates are the expert of their own experience, and it is crucial to allow them the platform to speak about their healthcare experiences, as well as what providers can do in order to better serve them. Thank you so much for your time. This project has received funding from the Arizona Developmental Disabilities Planning Council, and we would like to redirect you to the scannable QR code below that will lead you to the University of Arizona's Sonoran Center website regarding more information about this project and where the videos will be once this project concludes. Thank you.
This is being recorded so they can see everyone applauding for them afterwards. And so obviously we can't have Q&A for this session, but like they mentioned, their poster is going to be in the Padlet in our program, so you can always access using the QR code and learn more about the project. Okay. First up, we have Riley.
Hello, my name is Riley Aldrich. I'm in the certificate program, and yeah, you see all my degrees up there. Yeah, so for this project, I chose to talk about my research. A little bit about me. In the fall, I'm going to be starting my master's in counseling. So I was really interested in looking at the field of mental health service provision for individuals with autism. Or my original goal was to kind of look at, what strategies could counselors use when working with clients with autism, but there is not a lot of research on that. So I kind of had to expand my horizons and look at the field as a whole. So I kind of grouped my research findings into 4 main categories. And what the main finding that kind of guided it is that individuals with autism are more likely than their neurotypical peers to suffer from a mental health condition. However, they're less likely to receive quality mental health treatment. So I was kind of looking at the barriers to accessing care, providing care, and then a little bit more into adult outcomes. So I think the most important findings, first of all, barriers to accessing care is healthcare. So obviously you have those insurance limitations, you have accessibility based upon geographic location, et cetera. A unique variable to individuals with autism is this disconnect between the developmental disabilities system and the mental health system. You have these systems that don't really talk to each other. So when individuals with autism who have a mental health condition are trying to access care, they're kind of bounced around between the systems, not really, because the systems don't know what's wrong. Then barriers to providing care. This was obviously the part that I was most interested in, but there's not a lot of research. In one study that I looked at, 98% of mental health clinicians indicated that they would attend trainings on how to better serve clients with autism if they had the chance, but there's been minimal research on developing those trainings or assessing them. So that was probably the biggest future research direction that I indicated, is making this training that is comprehensive, that covers what autism is, what strategies can you use when working with individuals with autism. When looking at those specific mental health interventions that are just adapted for use for individuals with autism. So things like cognitive behavioral therapy, mindfulness therapy, those are far more common, but they don't involve any additional clinician training, which might be a problem. I identified one mental health intervention specifically designed for use for individuals with autism, and that was for children ages 5 to 13 years old. So it's great that they have that, but obviously you are not ages 5 to 13 years old for far longer than you are. So developing more interventions specifically for individuals with autism is a key need in the field. And then finally, I kind of looked at post-secondary education and employment as outcomes for adulthood, because a lot of the research focused on childhood. But again, people are going to be adults for far longer than they will be children. So individuals with autism and mental health disorders are more likely to be unemployed, and they're less likely to graduate from college. Specifically with unemployment, I identified this kind of negative loop where you are unemployed, you have a mental health condition, but which one comes first? Which one causes the other? There's not a lot of work done to understand that directionality, because if you are unemployed, how are you going to access mental health services? Through insurance, through transportation. But if you have a mental health condition, how can you stay employed without receiving that adequate treatment? So there definitely is more work to be done addressing unemployment specifically for individuals with autism. I think that just about sums up what I did. I would love to answer any additional questions you have later. So thank you.
Okay, Austin.
Hello, my name's Austin Randall. I am part of the Sonoran USAID Certificate Program for Developmental Disabilities, and I will be graduating in just a couple of weeks with a degree in psychology and rehabilitation studies and services. So this goes great after Riley's presentation. I did a literature review on the intersection of transgender autistic adolescents, and when conducting my research, I found that there was a very, very scarce amount of research on this intersection. We see a lot of the medical model of disability when talking about autism as well as transgender identities because of the way that society perceives them on the margins and seen as other. So I kind of looked into how what the mental health repercussions are of society sending this message that these identities are shameful or deserving of less respect. We see that transgender and autistic individuals typically report higher levels of depression, anxiety, suicidal ideation, self-harm, and an increase in social isolation. So not only are they being excluded from research, from media presentation, from psychological resources, but there's also an increased need for these communities to have a center for resources and someone looking out for them. We see the way that society treats this intersection specifically. A good example, I guess, is the Bud Light and Dylan Mulvaney. I'm sure you guys have seen this in the news. And this type of reaction to transgender and autistic adolescents is a massive reason that people don't feel comfortable outwardly presenting as such, which can lead to severe mental health repercussions. So my literature review, the purpose of it was to find, the mental health repercussions and how we can promote necessary radical change for these communities and to better show up for these communities. And doing so not only helps the individuals affected, but as well as the general community. So the findings of my paper were that we need to create more inclusive spaces, discuss this intersection in psychology courses, create more mental health resources. As Riley was saying, there's a lack of connection between the services for people with autism and the mental health side of the conversation. And this is true as well for the transgender community. Yeah, that concludes my paper, and I will be available for questions later.
Okay, Sylvia.
Hello everyone. My name is Sylvia Badger. I'm a junior here at the U of A, and I am in the undergraduate certificate for developmental disabilities. Okay, so my research looked at the intersection between adolescents with autism and health interventions. So I did a literature review that analyzed how children with autism are more likely to develop health problems such as diabetes, high blood pressure, and other things as they age. And part of the reason is because there aren't that many interventions in place for them when they are young and when they're able to make a lot of these healthy decisions. So in the research, I also compared children with autism and neurotypical children who are in kind of the elementary middle school age. And one of the things that I noted was that a lot of the typically developing children would participate in sports, participate in other competitive areas for physical health, and a lot of that excludes children with disabilities and especially children with autism. So what I wanted to focus on was how could we provide some intervention for them to not only have these not only like instill these healthy habits, but also to engage with each other. And one of the things that we wanted to do was to have a swim camp. It's a project that's still under development. It'll be launched in the summer, but we are wanting to have a swim camp intervention here at the U of A. We're looking at gathering just a small sample of children with autism in the community who can come to the University of Arizona's Recreation Center to have swim practices, and they will be learning how to swim but also engage with each other, and it'll be a fun non-competitive environment so that they do get those skills, both healthy skills and social skills. And so one of the goals is that not only will these kids be learning how to swim, they'll also be involved in non-competitive environment. And hopefully with this pilot study, we're looking to expand in other regions of Arizona, especially because swimming is something that's really important since it's a very, very hot state and a lot of people do have swimming pools in the neighborhood or even in their backyards. And swimming is a really, really important life skill to have in general, even if you don't live in Arizona. But this is what we're working on, and that is it for my presentation. If you have any questions, my email is on the bottom right corner of the poster, and feel free to contact me anytime. Thank you.
Hey, Amber.
Hello, my name is Amber Owens, and I'm a senior at the U of A completing an internship under the Sonoran USAID program. My internship is with Dr. Basford at the Family and Community Medicine Clinic at Banner University. So I go to Dr. Basford's clinic on Thursdays, where she treats adults with intellectual and developmental disabilities, or IDD. On those days, I shadow her to get an idea of how to interact with patients, as well as what healthcare can look like for people with IDD. The second part of this internship includes conducting research based on a paper I did last year on a similar topic. We decided to look into the experiences that adults with IDD had during the COVID-19 pandemic. During my review of the prior literature, I found that most of the studies focused on how the pandemic affected the caregivers, medical professionals, and family members surrounding those with IDD, while very few studies focused on interviewing those with IDD themselves. So for our research, we decided to interview the patients in Dr. Basford's clinic on their COVID-19 experiences. So there were 3 key themes that we found in the prior studies that we structured our interview questions around: obstacles to daily life, changes to accessibility, and issues adapting to these changes. We also decided to add in questions about services and supports, as we did not see any data on those topics. These questions covered what services and supports they normally have, how the services and supports changed during the pandemic and how the changes affected them, and what services and supports they would like to have in the future. During clinic visits, I conducted mock interviews with some of the patients to get used to the interview process, as well as to get feedback on what the patients think of the questions. From this, I was able to adjust my questions to better reflect what they were saying. The responses to the questions will be de-identified and coded into positive and negative responses. The positive responses will agree with question prompts, while the negative responses will differ. So for example, if we ask the participant, was it more difficult to access healthcare during the pandemic? A positive response would look like, I had difficulty with like this or that. Well, a negative response would be, my access to healthcare did not really change during the pandemic. So far, we haven't been able to produce any data, as we are still going through the IRB process to get our research approved. So for right now, this project is still ongoing, but we are hoping this research can give us more insight into what people with IDD face during the pandemic and how we can better accommodate them in future situations. As with all research, there are some limitations to the study. First, we're not able to interview a large number of people, so our data will not be representative of all individuals who have IDD. Secondly, our data will not include children or adolescents, as the clinic only takes people above the age of 18. Lastly, we will only be interviewing patients who speak English, as we are not able to fully accommodate those who speak other languages. So while this project is still ongoing, we hope that in the future it will provide some insight onto how to better provide accommodations to people with IDD. Thank you.
So I just want to give a quick shout out here to Amber because she is also a graduate of our certificate program last year where she started this project. And she actually gets to present in person this year versus our virtual last year. So thank you, Amber. And I just love that we have some of our trainees who continue to stay on with us in different capacities over the years.